Clinical mycotoxin challenges within pigs are often relatively easy to identify and treat. In these situations, symptoms become apparent very rapidly and are cured by feed removal. It is subclinical mycotoxin challenges that are relatively hard to detect and result in more financial loss for the pig farmers, as these subclinical challenges are not identified correctly. And the symptoms that can be just as wide-ranging as have been discussed before, but occur over a large period of time or a longer period of time and become lingering problems as the medical treatments that were recommended don't appear to solve the problem. In scenarios such as these, it is not until the mycotoxin challenge is dealt with that the pigs will fully recover. Therefore, where problems persist, despite the recommended treatments, consider testing for mycotoxins or adding sequestering agents